So obviously we start in the main lobby. The whole premise of the building was to make it easy for people to know where to go when they were coming to the hospital. So we had conversations about whether we should have multiple entrances or just a couple of entrances, and in the end we decided on the keep it simple principle. So we really have two entrances into the hospital for people who are coming in from outside. We have the main entrance, obviously, that we're standing in today, right now, and then we have the ED entrance. And the ED entrance is just a smaller version of the lobby. In both cases, they are really glass areas with ficus trees and plants. We do not duplicate the waterfall in the ED entrance, but you get the general drift of the. We can head down the garden walk here. The garden walk is really designed to be the main public thoroughfare for the building. So we have a higher percentage of circulation space than most places, and that's because we took care to have corridors where there could be patients and families without the public having to interfere. This is one of 4 courtyards that we have in the building. So in order to bring that daylight into 90% of the occupied spaces, we had to bring daylight down into the middle of the building, and we did that with 4 courtyards. This is really the largest of those 4 courtyards. This is the chapel. It's the only totally elliptical structure in the building. So when you're outside, it really shows up. The stained glass wall in here really has the same images in it that you see in our rondelles, which are in our lobbies, and they're just an expression of our faith-based heritage, but also Ohio Health's inclusiveness of all of the major world religions in terms of the people that work for us and the people that we care for. Fairly typical ED room. We have 32 beds, with the exception of our trauma room. Almost all of them look like this room. So the head wall in all the rooms except the trauma room is completely standardized. The rooms are a little bit wider than a typical or traditional ED room that you might see in other places. Mm-hmm. Almost all of them either have clear story that borrows from the front corridor, or they have windows. They have clear story that opens onto our courtyard. There's a courtyard here in the ED that I'll show you. Or they have windows that actually are along the outside wall. So almost all of the ED rooms have some access to natural light. There are a few in the interior that don't actually get any access to natural light, but most of them do. So these are registration cards, so you can enter data on the laptop. The little scanner allows you to scan people's driver's license and insurance card, and then you can actually print armbands and consent forms on the laser printer. You know, it's nice to be able to print and do everything in the room so that you can band the patient while you're still there and you know that you're banding the right patient. This is one of the spaces that we would intend to never really have to expand. So even as we grow from what we are today, which is a 94-bed hospital, to eventually someday being a 300-bed hospital, we wouldn't anticipate that we'll need to expand the lab. And as you can see, I mean, they've got windows on 2 sides. They're not in the basement. We probably do 80 or 85% of all of our lab tests in-house. So this is a typical, as in it is, the room. It is the acuity adaptable room. So it goes from med-surg to ICU. And we are using our rooms, we are implementing the acuity adaptable model across multiple specialties. We took the term family zone very seriously. So for us, a family zone wasn't a recliner that sat in the corner. The family zone for us is a double sleeper sofa, a small refrigerator, and a television. This piece of equipment is our bedside computing device, which we developed in collaboration with Cardinal Health. It gives the patient access to the internet, it gives the patient access to patient education, it gives the patient access to menus. So from the clinical side, it allows nursing and physicians to do documentation. It allows physicians to pull x-rays up and show them to a patient. And so if I was a patient, there would be a to-do list here, and the to-do list would have my educational assignments in it, for instance. If I wanted to order food, I can go over here, and the menus from the Waterfall Cafe are available here. Regular menu, heart healthy menu, diabetic menu, and I can go in there. I can decide what I want, and then I can either order online or I can call down to the Waterfall Cafe and order my food. These courtyards start down on second floor, which is where our maternity world is, and we have a courtyard in each pavilion. You know, the interesting thing about these courtyards is it allows us to have a visual connection to other areas of the hospital. So even though our staff is sort of divided on two sides of the unit, they can actually see one another. There's a typical labor and delivery room. We have 9 of these. They're about 400 square feet, including the bathroom. So this is the care channel. It cycles throughout the day, so it's on a 24-hour clock. And so as it gets later in the day, they have twilight and sunset. And then at night they have, stars and stuff like that. And they have great music throughout the day. And the care channel is really very cool.